Welcome to Eye Contact. I'm Francesco Carones. Today we are talking to Béatrice Cochener-Lamard about improving surgical outcomes with ocular surface disease treatment strategies. Welcome, Béatrice. How are you?
I'm fine.
So let's start. What happens when ocular surface disease goes undiagnosed prior to surgery?
Actually, I think that what is happening, it's something that nobody knows about. Having an unstable tear film can lead actually to a wrong measurement for the astigmatism. Will lead for sure to some induction of eye order aberration. I mean, any kind of glare, fluctuation, some disturbances like halos can be just related to the wrong and to the unstable, again, tear film. So what is nowadays very crucial when we know and we perfectly understood how works the tear film, it's the power, value, and the refractive effect of the tear film. So just looking out for giving that and forgetting the fact that we need to check the stability of the images, you can lead actually to wrong measurement of your refractive assessment, first of all.
Can you please help us understanding a little better what are the negative impacts of the surgical outcomes in our patients' quality of lives?
So first of all, regarding to what we said, you can first make a wrong choice for the toric lenses, and you can give this kind of unexpected results, what we can call this terrible surprise that you won't be able to explain. But on a regular basis, just looking on a standard implantation, especially of a premium lenses, fluctuation, unstable results, blurry vision will be maybe just related because of the ocular surface. And what will happen? The patients will be unhappy and with no explanation for that. The key issue is if you don't check the ocular surface and don't explain that to the patients before, how will be able to, you on your side and on his side, to accept the idea that it's just related to the ocular surface. So looking at what we call supervision, which is really definitely based on the quality of vision. I mean, by itself, the ocular surface disease and tear film instability especially will just impact this target of getting so-called perfection and great results.
I completely agree with you. My understanding is all these kind of diseases are kind of growing. We see many more patients now than in the past years. So what do you feel is the incidence of MGD in our common cataract population? And why do you think it's so important to address MGD before cataract surgery?
So first of all, I think that we've seen more because we are checking more. Because I mean, you find when you look for something. In addition to that, I guess that looking at the aging process, the changes in leads, the hormonal modification with the age, and the use of some medications makes the MGD becoming very much more frequent at the age of the cataract surgery. And we know that cataract surgery is becoming a refractive surgery since we're talking about visual and refractive performances. So having said that, we did actually a trial in our center that has been published, and we were able to demonstrate that the incidence of MGD at the age of cataract surgery, which is around between 60 to 80, is something like 42 to even 50% if you look to the literature review. And what is even more crucial to consider, it's 50% of them will be asymptomatic before the surgery. I'm afraid actually about the increase and the future increase that we may see. To me, the key concern should be actually the young population, because the way we are dealing with all the digital tools, looking on your screen, looking on your tablet, video games. I mean, people are decreasing the frequency in blinking, and we're going to see a huge increase in MGD even in the young population. That's going to be a big deal.
I think you're right on spot. So can you help us understanding better what are the specific testing that you are now doing for diagnosing MGD, and how did you implement your preoperative evaluation regarding that?
So first of all, especially for all the good colleagues of us who will listen to our discussion today, I would say that you don't need to buy sophisticated tool to start with. Just, expressing your glance and looking at the leads and checking the ocular surface, putting one drop of fluorescein, waiting long enough at least 1 minute, you will get the proper staining. The expression of the glands is crucial. I mean, just looking at the quality, can you get mebum? And what is the quality of this one? Will orientate you first to the severity of the disease, to the potential effect of some treatment that you can, of course, start, especially in the preparation of any kind of surgery, whatever they are, corneal or intraocular surgeries.
Very good. So we have a lot of tools for diagnosing. What about treating? What is your feeling about the meibomian gland expressors like the lippy flow and so?
You know, since I began to work in the field of ophthalmology, I always have been told, explain to your patients how they need to manage the way of warming and moistening, because warming and moistening are the two key values. I discovered that, not so many patients can understand, and at least for sure, many doctors are too busy to explain to do that on the proper way. So I think that what they developed, I'm talking about the industry, understanding that we need to support that on a better way, all these warming masks, these goggles that can also warm that on an automatic way are doing good. But there is still a big issue. How can we explain to the patient to express on a proper way the lens? So to do that, I must say that I give them frequently a short design on which I explain what is the architecture of these glands going vertically, and just to explain why there is a reason to do the massage going from the bottom going to the top, and in the adverse for the upper lid. We like to do that, explaining that on a paper, and I think that we should definitely, in terms of one of the mission, in terms of the educational program, we should have the patients to get on a very didactic way how it needs to be done. Because what is true, if you warm without doing the massage, the expression of the gland, it will never work. And it's a long process. The patient is expecting a very efficient and fast results, and it doesn't come. And so that's why I think that all the additional systems that can help you to warm the lids will help, but there is still the problem of the expression. So I had the chance, to approach this fancy tool, that the brush, that can help you to clean the edges, very interesting. I was not very convinced by the tube, because it's quite challenging to be able to do an intubation of the tube with just the transillumination of the lids. Can be actually challenging and even maybe a source of some trauma for the lids. And of course, if you're lucky and you can have an access to the very nice new platform, I'm thinking about especially the lippy flow that goes with the lippy view. That's a very interesting tool, because instead of warming, that's what the machine is doing, thanks to a pneumatic effect of the device that you're putting on the eye, that does aspirate in a certain way the content of the glands. So it's where we are, warming and eliminating the content of the glands. So we did actually a trial on this machine, and I must say that the effect for a moderate severity with still functional glands, of course, will take maybe 3 to 6 months. So it's very interesting. We do also have available now at the market the UV light that can do, we don't know actually how it works, but apparently the literature reviews show good, interesting results. So we are definitely on the way, but first of all, it's to teach the patients, to explain what's wrong behind that, and to first of all reinforce the idea that it's going to be a long-term treatment.
Thank you so much, Béatrice. And if you need more information on this and all related topics, please visit us at eurotimes.org.